So we are a typical African population with a very, very high base of young people and very little number of elderly people above the age of 65. Most of our population, they live in the rural areas. Besides the beauty and the smiley people of Zimbabwe, we still have got a big issues of TB and HIV.
The TB epidemic in the country is largely driven by HIV, where we are looking at 70% of TB patients being co-infected with HIV, which really becomes a priority area of focus. So we have been supporting the national response in terms of ensuring a more integrated approach.
Unfortunately, sub-Saharan African countries have been the hardest hit nations by the HIV epidemic. And due to the fact that HIV infection impairs human beings' immunity, the person becomes very vulnerable regarding the active tuberculosis disease.
Currently with the union, we have a partnership supported by USAID looking at how best we can implement TB HIV activities within the primary care setting.
The union came up with the idea for the integration of TB and HIV, which was tested in the form of a pilot. This integrated TB HIV care has worked, and now this has been adopted by the Ministry of Health as good practice.
A patient doesn't have to access services at different service points. Everything would be under one roof.
My name is Constance Manwa. I'm a patient from Zidiga's clinic here in Bulawayo, Zimbabwe. I've been treated for MDR TB when I was pregnant with my firstborn baby. That's when I was tested for HIV. I tested positive.
The union was very instrumental in bringing in the integrated TB HIV approach. When we started, we had to make sure that we came up with some guidelines of how patients should be integrated into HIV care. We also put TB in the agenda, trained staff first and foremost on TB management, HIV management, and how to integrate the two.
Everyone was trained here by the union. Every nurse is taught everything about HIV patients, about TB patients, because every department now incorporates TB.
I started losing weight before I started taking drugs. I lost strength. I was becoming very weak. I started deteriorating, and when I realized it's not going well for me, I came to see the sisters here. That's when they started helping me with ideas and medication and stuff.
Our main goal is to capture all the TB patients around, to treat them, to ensure that they are tested for HIV.
This is our reception. Our patients come through the gate, they wait in the shed, and then they come to the clerk to get registered. Then they come to this bench, they wait on these benches before they get into the consultation rooms. The consultation room, the registered general nurse will take a full detailed history from the patient and also ask about any history of a cough, any history of night sweats, any history of a fever, using the TB screening tool. Every TB patient is screened for HIV at this clinic, and every HIV positive patient is screened for TB at this clinic.
The nurses themselves are the ones who perform provider-initiated testing and counseling for all TB patients.
Just went so well, and I started gaining weight, started gaining strength, started gaining confidence, started feeling alive again.
We are happy to provide the treatment because there is much improvement on the patient. So you feel happy when you find that you are doing a good job to a patient.
We know 70% of our people are in the rural areas, and our fight and our drive is to say, let's challenge 70% of our resources to those people.
Here we are looking after patients who are really unable to help themselves. They don't have funds for the drugs, and they don't have even funds to board a bus to come to the hospital.
We have done quite a lot to make sure that at least despite the access issues, make sure that the antiretroviral medicines are available and the anti-tuberculosis drugs, they are available to the patients. And that's a big achievement for the country because you find the medicines everywhere. Within the community itself, they select what they call village health workers. These people are then trained by the Ministry of Health. They can identify a person with signs and symptoms of TB to say, this patient, why don't you be checked? They can identify and advise people on HIV infection. And they are like the front local people.
I take all my time visiting all over the community, trying to see people whether they're feeling well, what problem they have, and taking all the cases from these TBs, make sure that they don't default and they take that tablets in time and they go to review in time.
They play a very, very pivotal role in the country when it comes to TB treatment. They actually go out there, they actually observe the patients swallowing treatment.
Some of them, they start serious. When they go on using their tablets, they become better. They become better as time goes on.
I'm glad that as a country, Zimbabwe has taken up the TB HIV model, first in other municipalities and now in the rural areas. And having shown the good results of patient retention, bringing a life, quality of life, which really affects families. Because when someone is better, they go back to work, their family is no longer suffering.
We have demonstrated that indeed we can provide integrated and decentralized TB HIV services, even at the primary healthcare level, within resource-limited settings such as ours in our country in Zimbabwe.
It brings me joy and satisfaction when innovative and useful solutions are brought to the doorsteps of the poor and most vulnerable, which I think is what the Union stands for.
This country is one of the success stories of managing HIV properly. As we begin to control HIV, TB prevalence is also now beginning to come down. We have the tools, we have the strategies, we know how to detect TB, we know how to treat it, and I think even in the setting of HIV, we can deal with TB in Zimbabwe.
I was successfully cured. I'm happy, I'm so glad because the staff was so kind, was so friendly. I'm so happy. I don't even know the donor, but I'm so happy because I'm here because of the donors. My son is bouncing, he's 6 years old now. We are happy.
I'm really proud to be associated with such success and saving lives and working with the communities.
I just want to say to the whole world that being HIV positive is not the end of the world. You can still do wonders. You can still do wonders as long as you accept your status and move on, and you learn to live positively. You learn to live positively.
What do you want with